Welcome to the Deep Dive. Today we're jumping into traditional Chinese medicine. We're looking specifically at Volume 4 of the World Century Compendium to PCM, the part called Introduction to Chinese Internal Medicine.
That's right. And this is really for you if you're interested in getting a good grasp of TCM internal medicine concepts, kind of quickly but thoroughly.
Yeah, like a shortcut. We want to pull out the key ideas, the practical stuff, maybe some of those aha moments without getting totally lost in the weeds.
Exactly. Our mission is extracting those core insights. And the excerpts cover a lot: cardiovascular, digestive stuff, even neuropsychic conditions, connective tissue diseases. It gives you a real sense of the scope.
Okay, so quite a range. Let's dive in.
Yeah.
How about we start with something, well, pretty common.
Headaches.
Okay. TCM has an interesting take. It separates headaches caused by external things. They call it exogenous pathogenic factors, like wind cold, from headaches linked to internal stuff, like, say, hypertension or arteriosclerosis.
Wind cold headache. That sounds specific. What does that look like? Well, the text describes it as pain that sort of comes and goes, often hits the nape of the neck, the upper back. It gets worse if you're out in the wind.
Makes sense.
Yeah, and you'd likely feel an aversion to wind and cold, not be thirsty, have a thin white coating on your tongue.
Okay.
And the pulse, they say, feels floating, like it's right on the surface.
Interesting. That detailed picture is classic TCM, isn't it? Linking all those signs.
It really is. The key thing here is how TCM sees external factors, the environment, directly causing these specific patterns inside the body.
Right. Okay, what's next? Vertigo is mentioned.
Yeah, another common one. And the text actually poses a question for us or for the reader. Lists the different types of vertigo.
Ah, so TCM doesn't just see it as one thing.
Apparently not. Our excerpts don't list all the types, but the question itself tells you TCM looks for different underlying causes. It's not just, dizziness.
And there's another question in there too, right? About liver yang.
Yes. Describe the clinical characteristics of vertigo due to hyperactivity of liver yang. Again, we don't get the full answer here, but it points to how TCM diagnostics work. They're looking at organ systems like the liver and how an imbalance there, too much yang or upward energy, could cause vertigo.
It really shows that interconnectedness you hear about in TCM, how one system affects another.
Absolutely. That's fundamental. Okay, let's shift to something else many people deal with: insomnia. TCM calls it sleeplessness.
And it often comes alongside other issues.
Yeah, the text notes it's frequently seen with things like depression, hypertension, and what they call climacteric syndrome, basically, menopause.
Okay. And again, the text prompts us.
Right. List the common causative factors of insomnia and explain how insomnia due to deficiency of the spleen and stomach can be diagnosed and treated.
Deficiency of the spleen and stomach causing insomnia. That might sound a bit strange to some people.
It might from a Western view, yeah. But in TCM, the spleen and stomach are crucial for digestion, making qi and blood. And good quality qi and blood are seen as essential for calming the mind for sleep.
So poor digestion could actually mess with your sleep.
That's the idea. If the spleen and stomach are weak, they can't nourish the heart and mind properly. So the key insight: TCM sees your gut health as directly linked to how well you sleep.
Fascinating. Okay, let's move to sweating syndrome, abnormal sweating.
Yes, the text lists 5 types: spontaneous sweating, night sweats, collapse sweating, yellowish sweating, and shiver sweating.
Quite a few.
But it does say spontaneous sweating and night sweats are the ones seen most often.
And there's a specific pattern mentioned for spontaneous sweating. Insecurity of lung way. What's that about?
Right. So the symptoms are sweating easily, especially with exertion, but also having an aversion to wean, catching colds easily, feeling tired.
Okay.
Maybe a pale complexion, thin white tongue coating, and a weak pulse.
So why do those things cluster together in TCM?
The thinking is that the lung qi is weak. Lung qi is related to breathing, yes, but also to the body's first line of defense, the wei qi.
The defensive key.
Exactly. If that's weak, the pores aren't regulated properly, leading to the spontaneous sweating and sensitivity to wean. Exertion uses up more lung qi, so sweating gets worse. The tiredness, pale look, weak pulse, those are general signs of qi deficiency.
So it's like the body's protective shield is down.
That's a great way to think about it. It links lung function directly to surface defenses.
Okay. Let's switch to digestive issues now. Diarrhea. TCM mentions external factors again.
Yes, definitely. One pattern they detail is diarrhea from contraction of damp heat, sometimes called summer heat.
Damp heat. What are the signs?
Abdominal pain, really urgent bowel movements, yellow-brown stools that smell bad, maybe a burning feeling down there.
Right.
Also feeling hot and bothered, thirsty, but maybe not passing much urine, and it could be dark yellow. The tongue often has a yellow, greasy coating, and the pulse is rapid, maybe feels soggy or slippery.
So how does TCM explain that?
The damp heat pathogenic factor basically gums up the works, impairs the spleen and stomach's job of moving things along. The heat part causes the urgency, the smell, the burning. The dampness contributes to the diarrhea itself and the urine changes. The feverish feeling, the tongue, the pulse, all point to that internal damp heat picture.
So it connects specific environmental evils to acute gut problems.
Exactly. Then there's another type, retention of food in the stomach and intestine.
That sounds more straightforward, like you ate something bad or too much.
Pretty much. Symptoms are abdominal pain, maybe gurgling sounds, loose stools smelling like rotten eggs, feeling better after you go, sometimes seeing undigested food. Plus feeling stuffed up, maybe burping up foul or acidic stuff, poor appetite.
The undigested food seems like the big clue there.
It is. Improper diet or just eating too much leads to food stagnating. It doesn't get processed right. That causes the pain, the fullness. The smell is from fermentation. And feeling better after going makes sense you're getting rid of some of the backlog. The tongue might look thick or greasy, pulse slippery signs of that internal blockage.
So a direct link between what you eat and how your gut reacts.
Absolutely. And the text adds some cautions. Treat diarrhea promptly to avoid it becoming chronic. Watch your diet, avoid greasy, fatty, sweet, raw, cold, unclean food.
Standard advice, but framed within TCM.
Right. And physical exercise helps strengthen the system overall. And of course, more questions pop up in the text.
Yeah.
Name the exogenous pathogenic factor most closely associated with diarrhea. Probably dampness. It comes up so often with digestion. And describe the characteristics of diarrhea due to deficiency of kidney yang.
Kidney yang deficiency causing diarrhea.
Interesting. Yeah, it suggests the kidney's warming function is also important for digestion. So TCM looks at both external triggers and internal weaknesses.
Let's flip to the opposite problem. Constipation. The excerpts focus on deficiency types.
Yes. One is constipation due to deficiency of Chi. This is interesting. You feel a strong urge to go, you really strain.
Yeah.
You might even sweat or get short of breath trying, but you just can't pass a stool, even if it's not necessarily hard. Plus, maybe a pale complexion, feeling tired. Pale tongue, weak pulse.
It's like the body wants to, but doesn't have the energy.
Exactly. That's a great way to put it. TCM links it to weak lung Chi, the lungs have a connection to the large intestine, and weak spleen Chi, overall energy production. Straining just uses up more of that limited Chi.
So you need enough oomph just to have a bowel movement.
Pretty much. Sufficient Chi is key for elimination. Then there's constipation due to predominance of cold.
Cold constipation, how does that show up?
Difficulty defecating, yes, but also things like passing a lot of clear urine, pale face, cold hands and feet, really preferring warmth, hating cold.
Okay.
Maybe abdominal pain or back soreness that feels better with heat. The tongue is pale with a white coat, pulse is deep and slow.
So the cold itself is slowing things down.
Right. It's seen as a deficiency of yang, the body's warming, activating energy. This internal cold makes the intestines sluggish. All the cold signs point to that underlying yang deficiency. Even the clear urine suggests fluids aren't being transformed properly by that weak yang.
So internal cold can be a real blocker.
Definitely. And TCM gives general advice too. Light diet, more fruits and veggies, and keeping your spirits up, that emotional balance is important.
Always circles back to the holistic view. And more questions in the text, I assume.
Yep. List the etiological factors of constipation. Describe constipation due to key stagnation, and explain how constipation due to accumulation of heat can be diagnosed and treated. So besides efficiency, TCM also looks at blockages from stuck energy or internal heat, drying things out.
Lots of angles. Okay, let's broaden out to bleeding. The text covers quite a bit under this.
It does. Hemorrhage, peleosis, DIC, they group it as bleeding syndrome, but the excerpts focus on acute stuff. Vomiting blood, metamesis, coughing blood, hemoptysis, blood in stool, hemophagia, blood in urine, hematuria, nosebleeds, hemorrhagia.
And the approach is twofold. Stop the bleeding, but also treat the cause.
Exactly. You have to manage the acute situation, but figure out why it's happening to prevent it coming back.
One treatment principle mentioned is for bleeding caused by wind cold.
Right. Dispersing wind and dissipating cold, regulating Qi and activating blood. And they list a specific herbal formula, Jingji, Fangfeng, Chuanxiao, and others, with modifications like adding mahuang and gizi if the external cold is severe.
Tailoring the treatment.
Always. And there's a principle for wind heat bleeding, too. Use pungent, cool herbs to relieve the superficies, basically, clear the heat from the surface level. Different strategies for different underlying patterns.
Makes sense. Okay, let's shift to the respiratory system. Bronchitis first. Defined as inflammation of the airways, often from infections or irritants. Cough with sputum, chest discomfort.
Right. And they distinguish acute, less than a month, from chronic, lasting much longer. Acute can happen at any age, chronic more in adults, often worse in winter-spring. Prognosis for acute is usually good if treated. TCM links it to patterns like cough, phlegm, and panting.
Key diagnostic points mentioned are like upper respiratory symptoms first, then the cough starts dry and becomes productive, plus what they hear with a stethoscope. And for chronic, the duration is key.
Then we get into the patterns. First, invasion of wind heat into the lungs.
What does that look like?
Cough, maybe rapid breathing, hard time coughing up yellow, sticky phlegm, yellow nasal discharge, headache, achy limbs, fever, slight aversion to wind. Tongue might have a thin yellow coat, pulse floating, and rapid or slippery.
So the wind heat is seen as directly messing with the lungs' function.
Exactly. It impairs the descending and dispersing function, causing the cough. The heat dries up fluids, making the phlegm thick and yellow. The fever, aches, those are the systemic effects of the wind heat invasion.
Okay. Then there's impairment of the lungs by wind dryness.
Right. This one features a dry, maybe hacking cough. Dry throat, nose, mouth, sticky phlegm that's hard to get out, maybe nasal congestion, headache, mild chills, and fever. The tongue looks red and dry, pulse floating and rapid.
Dryness is the big theme here.
It is. The wind dryness is seen as directly injuring the lung fluids, causes the dry cough, the dryness everywhere else. The other symptoms point to the wind aspect disturbing the surface. Different pattern, needs a different approach than wind heat.
Got it. Now for chronic bronchitis patterns. Accumulation of phlegm and dampness in the lungs.
This is a persistent cough, but with lots of white, sticky sputum. Feeling of chest distress, maybe stomach stuffiness, poor appetite, abdominal bloating. Tongue has a white, greasy coat. Pulse feels taut slippery or soggy slippery.
So here it's about internal gunk building up.
Exactly, often linked to the spleen not handling fluids well. Dampness forms, turns into phlegm, settles in the lungs, obstructs the lung, hence the cough. The digestive symptoms point back to that spleen imbalance. The tongue and pulse are classic signs of phlegm damp.
So chronic lung issues can be linked back to digestion in TCM.
Very often, yes. Another chronic pattern is deficiency of the lungs and kidneys.
Okay, what are the signs here?
Chronic cough, shortness of breath, thin sputum, feeling cold, cold limbs, maybe swollen feet. Poor appetite, weak or sore lower back and knees. Tongue looks pale, maybe enlarged, white coat. Pulse is thin and deep.
Sounds like a more systemic weakness.
It is. The idea is weakness in the spleen and kidneys leads to water dampness accumulating and backing up into the lungs. Deficiency of lung and kidney yang, the warming energy causes the cough, shortness of breath, cold signs. The digestive and lower back knee symptoms point to the spleen-kidney route.
So problems lower down can manifest up in the lungs.
That's a key TCM concept, and the text mentions modifying formulas, adding herbs like huangqin for lung heat or shagan for sore throat. Tailoring again, it also briefly mentions impairment of the lungs by dry heat.
Okay. And one more under bronchitis, deficiency of lung wei. We touched on wei tea earlier.
Right. This links back. Symptoms. Spontaneous sweating, can't tolerate wind, catches colds easily, sensitive to weather changes, shortness of breath with a low voice, thin white sputum, pale complexion, pale tongue, weak pulse.
Back to that weak defensive shield.
Exactly. Weak lung qi leads to weak wei. Can't protect from external factors, hence the sweating, wind intolerance, catching colds. Can't transform fluids properly, thin sputum, shortness of breath. Pale signs show the underlying deficiency.
It's a detailed breakdown of how lung weakness affects the body's defenses.
Very detailed. The text also lists diagnostic points for bronchiectasis, like chronic cough, maybe bloody sputum, recurrent infections, specific lung sounds, imaging findings, and poses another question. Explain how bronchitis due to deficiency of lung qi and wind invasion can be diagnosed and treated, highlighting combined patterns.
Yeah, it's never just one simple thing, is it?
Rarely in TCM. Okay, moving on to pneumonia. Inflammation of the lung tissue itself. Chills, high fever, cough, sputum, chest pain are main symptoms. More common winter spring, young middle-aged males. TCM links it to things like windworm disease or lung heat disorder.
Diagnostic keys for bacterial pneumonia sound pretty familiar. Sudden onset, high fever, chills, chest pain, maybe bloody sputum, shortness of breath.
Right, plus physical exam findings like crack holes, lab tests, and x-ray showing shadows.
And lung abscess is mentioned too. Sounds serious.
It is abrupt, high fever, chills, coughing up lots of foul, pus-like sputum, high white blood cell count. X-ray shows cavities, fluid levels.
And the text describes the initial stage pattern for lung abscess.
Yes, aversion to cold, fever, cough with increasing white, foamy sputum, chest pain worse with cough, difficulty breathing, dry mouth nose, red tongue, thin yellow coat, rapid floating slippery pulse.
How does TCM see this stage?
As wind heat invading the lungs, causing a clash between defensive qi and the pathogen, lung qi function gets disrupted. The heat signs are the dryness, red tongue, yellow coat. Chest pain suggests stagnation in the lung channels.
And they mention treatments.
A powder of Baiji, Xiangbei, and Baihe for the recovery stage, aiming to nourish yin and resolve phlegm. Also, ultrasonic nebulization with herbs like yuxincow. It's a nuanced approach even for acute infections.
Okay. Pulmonary tuberculosis. Diagnostic points seem focused on chronic symptoms. Long-term low fever, night sweats, feeling unwell, weight loss, cough, maybe bloody sputum, chest pain.
Plus specific exam findings, positive TB tests, and X-ray changes.
And a key TCM pattern is deficiency of yin and yang of the lungs and kidneys. That sounds quite severe.
It represents a deep level of depletion. Symptoms are extensive: chronic cough, maybe bloody, shortness of breath on exertion, night sweats, dry mouth throat, flushed cheeks, heat in palm soles, hoarse voice, scanty sputum, loose stools, diarrhea, backache.
Wow, it affects everything.
Pretty much. Impotence emission in men, menstrual issues, emaciation in women. The tongue can be red dry or pale with teeth marks. Pulse varies thin, rapid, or deficient, large, feeble. It's a profound yin and yang deficiency impacting multiple systems, including core energy reserves like the life gate fire.
Then treatment.
A decoction with Lukao, Baibu, Baiji, Shakukao is mentioned for clearing lungs and stopping bleeding. Lifestyle things, too. Taijiquan, specific dietary soups like shuang soup. The text stresses it's chronic, needs a holistic, long-term approach.
Right, supporting the whole system, not just fighting the infection.
That's the core idea. Okay, next. Pulmonary heart disease. Basically, heart problems arising from chronic lung disease. It involves dysfunction of lungs, heart, spleen, and kidneys.
So the lungs affect the heart over time.
Exactly. Diagnostics involve a history of lung disease, then worsening symptoms like palpitations, severe shortness of breath, cyanosis, bluish skin, even neurological signs like headache, restlessness. Physical exam shows signs of emphysema progressing to right heart failure, neck vein distension, edema.
And the TCM analysis connects the dots between the organs.
Yes. Lung problems strain the heart. Spleen issues can create phlegm, burdening both. Kidney problems affect fluid balance, worsening heart issues. They mention formula modifications for spleen deficiency, lung cold, severe breathlessness, yin damage. Chung Kao Laya soup, again, for diet.
And prevention is key.
Absolutely. Treat the underlying lung disease, avoid things like cold exposure that worsen it, protect the lungs to protect the heart.
Makes sense. Now, just palpitations on their own. One pattern is exuberance of fire due to yin deficiency.
Symptoms: palpitations, feeling uneasy or vexed, insomnia, dizziness, heat in palm soles, tinnitus, sore waist, red tongue, little coat, thin, rapid, or abrupt pulse.
So, not enough coolant yin leads to too much heat, fire.
That's the concept. Kidney yin is insufficient, can't control heart fire. This hyperactive fire disturbs the heart spirit, causing palpitations, insomnia. The other symptoms like waist soreness, tinnitus, heat signs all stem from that yin deficiency. A modified Guipi pill is mentioned to nourish Qi blood and calm the spirit.
Okay. Valvular heart disease. Diagnostics focus on heart failure symptoms, palpitations on exertion, shortness of breath, waking up breathless, cough, bloody sputum, edema, plus specific signs like mitral facies and valve murmurs.
And TCM patterns. One is qi and blood deficiency of the heart and spleen. Symptoms: palpitations, chest distress, shortness of breath, sweating worse with exertion, pale face, dizziness, pale and large tongue with teeth marks, thin or soggy, feeble pulse.
Sounds like general weakness affecting the heart.
It is. The disease process depletes healthy qi, leading to weak heart qi and blood. Not enough blood nourishes the head, causing paleness, dizziness. Tongue and pulse confirm the deficiency.
And another pattern.
Yang deficiency of the heart and kidneys. Dark, dull complexion, palpitations, edema, cough, rapid, difficult breathing, can't lie flat, cold hands, feet. Dark tongue, white, slippery coat. knotted, intermittent, or thin, deep pulse.
So this is a lack of warming energy.
Right. Heart and kidney yang are weak, can't circulate fluids properly, leading to edema, breathing issues, cold signs. Treatment involves modified formulas like Weepy decoction for Qi blood deficiency or Zang-Fu decoction for yang deficiency, with specific additions for things like blood stasis or severe symptoms.
And lots of lifestyle advice.
Yes, keep warm, avoid damp, infections, stress. Good diet, avoiding excesses, no smoking alcohol, balance work risk, exercise, very holistic management. And again, questions are posed about pathological changes and treating obstruction of heart blood. So TCM also considers blockages, not just deficiency.
Right. Coronary artery disease now. One pattern detailed is obstruction of turbid phlegm.
Symptoms: chest distress or pain, shortness of breath, feeling heavy, tired, especially in the limbs, sleepiness, tongue has a turbid, greasy coating, slippery pulse.
So phlegm is seen as physically blocking things up in the chest.
Exactly. Weak spleen function leads to this turbid phlegm. It accumulates, obstructs chest yang and qi flow, causing the pain distress. Impaired spleen function also explains the heaviness and limb weariness. Tongue and pulse confirm the phlegm.
So digestive health impacting heart health again.
A recurring theme. Now, hypertension. Diagnostics mention history, type of headache, temple vertex, pricking, dull, distending, often no physical signs early on.
And a key TCM pattern.
Hyperactivity of liver yang, headache, dizziness, flushed face, irritability, insomnia, tinnitus, blurred vision, numb tingling limbs, reddish tongue, thin coat, thin, weak pulse.
Liver yang, like the liver's energy rising uncontrollably.
Sort of, often linked to underlying liver-kidney yin deficiency. Not enough coolant, so the yang flares up, causing the headache, dizziness, flushing, irritability. Yin deficiency also explains the poor nourishment leading to blurred vision, numbness. Modified Tianma Goteng potion aims to calm that rising liver yang.
So hypertension isn't just blood pressure, it's an organ imbalance.
From a TCM view, yes. The text briefly mentions dietary therapies for cardioneurosis, 2 specific soups or porridges for palpitations or insomnia, food as medicine.
Right. Okay, let's get back into the digestive system. Reflux esophagitis. One pattern is upward rebellion of stomach qi due to liver-stomach disharmony.
Symptoms: burning behind the sternum, acid reflux, belching, nausea, vomiting, maybe distending pain under the ribs, sometimes trouble swallowing, red tongue, thin yellow coat, taut pulse.
So stress or emotions, liver, can make stomach acid go the wrong way.
That's the idea. Liver stagnation disrupts the stomach's normal downward qi movement. It rebels upwards, causing reflux. Modifications are mentioned for specific symptoms like vomiting or hiccups. It really highlights that mind-gut connection.
And another pattern, accumulation of heat with depletion of yin.
Symptoms: burning, retrosternal pain again, but also dry mouth, throat, thirst, maybe even vomiting blood. Red tongue, scanty coating, thin, rapid pulse.
Sounds like internal heat drying things out.
Exactly. Stagnant heat consumes yin fluids, leading to dryness, pain, potentially damaging vessels causing bleeding. Treatments mentioned aim to nourish yin, generate fluids. And avoiding spicy, irritating food and alcohol is key.
And the text asks about esophageal cancer diagnostics and treatment, showing TCM addresses serious conditions too.
Yes, often focusing on resolving stagnation, clearing toxins, and supporting healthy qi.
Okay, peptic ulcers, sores in esophagus, stomach, duodenum from gastric juice. Key symptom is that periodic, rhythmic upper belly pain related to food, plus reflux, nausea, vomiting, maybe bleeding. TCM calls it stomach ache, vomiting, etc.
And the advice is heavily lifestyle focused. Avoid stress, overwork, irregular habits, smoking, alcohol. Eat nutritious, easy to digest foods, small frequent meals, chew well, fixed meal times. Avoid extremes of temperature, irritating foods, coffee, strong tea. Stop bleeding first if that's happening.
Very practical. Chronic gastritis now. One pattern, accumulation of dampness and heat in the stomach.
Symptoms: epigastric stuffiness, distension, pain. Poor appetite, nausea, vomiting. Thirsty but don't want to drink much. Maybe gurgling sounds, loose stools, or constipation. Red tongue, especially tip margins. Yellow, greasy coating. Slippery, rapid pulse.
Dampness and heat gumming up the stomach.
That's the picture. Disrupts digestion. Another pattern is qi stagnation of the liver and stomach.
Liver again?
Yep. Gastric hypochondriac pain, distending type, worse after eating. Belching, upset stomach, nausea, vomiting, acid reflux. Reddish tongue, white thin coat. taut pulse.
So liver qi can get stuck and invades the stomach.
Exactly. Dietary therapies are mentioned too. Milk madzun for atrophic gastritis, sugarcane juice if there's stomach in damage. General advice similar to ulcers: avoid irritants, manage anemia, small frequent meals. Superficial gastritis prognosis is good, but can progress to atrophy.
Okay. Gastreptosis, sagging stomach.
Okay.
Diagnostics include epigastric discomfort, worse standing, straining, bloating, belching, nausea, poor appetite, maybe alternating diarrhea, constipation, palpitations, postural hypotension. Specific physical signs and X-ray findings.
And a TCM pattern, deficiency of stomach kin. Gastric abdominal distension fullness, feeling vexed unwell, especially after meal exertion. Thirst, bitter taste, maybe retching, constipation. Red, dry mouth lips, reddish tongue, scanty coat. Thin, rapid pulse.
So lack of nourishing fluids contributes to the stomach sagging.
It's part of it. Spleen deficiency can cause qi sinking, while stomach yin deficiency creates deficient heat. Both yin fluids and qi energy lift are needed for proper organ position and function.
Right. Irritable bowel syndrome, IBS. One pattern.
Yeah.
Stagnation of damp heat.
Symptoms: sudden abdominal pain, tenesmus, feeling like you need to go but can't, anal burning, maybe fever, chest distress, nausea, bitter taste. Stools might have mucus, pus, blood, yellowish urine, red tongue, yellow greasy coat, rapid slippery pulse.
That's something an acute flare-up.
It does.
Yeah.
Damp heat accumulation blocks qi flow, can damage intestinal vessels, modification mentioned for blood and stool. Another pattern is yang deficiency of the spleen and kidneys.
We've seen this one before.
Yes, similar picture. Vague abdominal pain, maybe worse sometimes. Loose stools or classic dawn diarrhea. Fatigue, feeling cold, poor appetite. Weak sore low back knees. Pale face, pale tongue, thin feeble pulse.
Lack of warming energy affecting the bowels.
Exactly. Spleen-kidney yang deficiency impairs digestion and fluid transformation.
The text then mentions things for intestinal cancer patent medicines, herbal prescriptions, dietary therapy, pork with garlic, and asks about gastric cancer treatment and cautions. TCM clearly has approaches for these too.
Yes, focusing on the underlying imbalances, qi stagnation, blood stasis, phlegm, toxins to support the patient.
Ulcerative colitis, chronic inflammation of rectum colon, chronic diarrhea, bloody mucousy stools, tenesmus, abdominal pain, maybe fever, weight loss, anemia. TCM links it to dysentery, diarrhea, hemophagia.
Diagnostics involve symptoms, sigmoidoscopy, barium enema labs. One TCM pattern is obstruction of blood stasis in the intestinal tract.
Blood stasis causing bowel inflammation.
That's the idea. Symptoms: pricking abdominal pain, worse with pressure, purulent or dark, clotted, bloody stools, dark, dull complexion, dark red tongue, maybe bruises, thin, taut pulse, stagnant blood blocks, qi leads to pain, pus formation. Dietary porrages are mentioned for underlying spleen deficiency.
So improving circulation is key there. Intestinal tuberculosis. Diagnostics include TB history, abdominal pain, diarrhea, constipation, fever night sweats, abdominal distension masses, tenderness, maybe fistula, X-ray labs, drug trial.
And the yang deficiency of the spleen and kidneys pattern appears again. Vague abdominal pain, loose stools, dawn diarrhea, fatigue, coldness, poor appetite, weak sore back knees, pale look, pale tongue, weak pulse.
So systemic weakness makes one vulnerable or complicates the infection.
That's a common TCM perspective. Cirrhosis next. Diagnostics involve history, hepatitis, alcohol abuse, etc. Compensated stage has subtle symptoms: liver discomfort, fatigue, poor appetite, maybe pain bloating. Decompensated stage is much worse: hardened shrunken liver, ascites, bleeding tendency, vendus, spider veins, liver palms, esophageal varices bleeding, hepatic coma, plus lab tests, imaging, biopsy. A TCM pattern is stagnation of Curet with retention of dampness, enlarged, distended, but not hard abdomen, costal distension pain, poor appetite, belching, fullness after eating, scanty urine, white greasy tongue coat, taut pulse.
Block energy and fluid buildup.
Yes. Liver Curet stagnation plus weak spleen function leads to dampness accumulating. Dietary advice is crucial: easily digested, high-calorie nutrient food, strict protein restriction if liver function is poor. Avoid alcohol, animal fats, careful with hard course foods to prevent variceal bleeding, low salt for edema, help constipation with sesame oil, honey, etc. Support liver, manage fluids.
Primary hepatic carcinoma, liver cancer. Diagnostics. Early signs, often vague liver discomfort pain, worsening fatigue, appetite loss, weight loss. Later, significant pain, emaciation, progressive liver enlargement, ardenous nodules, jaundice, fever, weakness, splenomegaly, sites, cachexia, complications like bleeding or coma. High AFP blood test is key. Imaging confirms.
A TCM pattern is stagnation of liver qi, hypochondriac pain right side, chest distress, abdominal fullness distension, frequent belching, poor appetite. Thin tongue coating, taut pulse.
Emotions again linked to liver stagnation.
Yes, seen as a key factor in TCM. Acute pancreatitis. One pattern, transformation of stagnated liver qi into fire.
Liver key stagnation turning into fire.
Exactly. Symptoms. Sudden, severe abdominal agony, mid-upper belly radiating, fever, dry throat, bitter paste, belching, nausea, vomiting, dry stools, red tongue, yellow coat, rapid, taut pulse. Emotional blockage generates intense heat. Prognosis varies.
Cholecystitis, cholelithiasis, gallbladder issues generally have good prognosis, text says, and asks about diagnostics treatment. TCM likely links it to liver key stagnation and damp heat.
Very likely. Soothing the liver, clearing damp heat would be the focus. Viral hepatitis, communicable disease, weariness, fever, jaundice, nausea, vomiting, poor appetite, liver pain, tenderness, enlargement. Severe cases have bleeding, neurosymptoms, types AE, different clinical forms. TCM calls it hypochondriac pain, jaundice, etc.
Prognosis varies a lot by type.
Yes, A, usually good. B, prone to chronic cirrhosis. CE, also prone to chronic. Chronic active, worse than persistent. Serious forms have high fatality. Chronic B linked to liver cancer risk. Dietary therapies mentioned. Specific porridge spouters. Advice. Isolate an acute stage dietary hygiene. Avoid raw choledolispacy in acute phase. Light diet for fever. Replenish fluids for diarrhea.
Bacillary dysentery prognosis, usually good if acute. Text asks about diagnostics treatment, likely clearing heat dam toxins.
Standard TCM approach for acute gut infections, yes. Nephrotic syndrome. TCM etiology involves external factors, wind, damp, heat, toxins, overstrain, and internal organ dysfunction, lung, spleen, kidney, triple energizer, and water metabolism.
So multiple organs involved in fluid balance.
Yes. Lung issues affect upper body water. Spleen issues cause mid-lower body dampness. Kidney issues impair excretion. Prolonged illness can lead to critical yin-yang imbalance. Diagnostics, edema, high urine protein, 3.5 G24H, maybe blood in urine, low blood albumin, high lipids cholesterol, dietary therapies mentioned, corn silk watermelon peel decoction or carp boiled with herbs like huangquefuling. Understanding the TCM type is key for treatment.
And it asks for diagnostics and treatment based on differentiation, so figuring out which organs are mainly involved.
Exactly. Is it mostly lung, spleen, or kidney imbalance, or a mix? That guides the therapy. Pyelonephritis, kidney infection, inflammation of kidney tissue pelvis, often ascending from lower urinary tract, acute to chronic, lumbago, frequent turgent, painful urination, common in women. TCM links to stranguria patterns.
Painful urination.
One pattern, damp heat obstructing the interior.
Symptoms, chill shy fever, worse PM, yellowish red painful urination, foul breath, gastric abdominal fullness, hungry but not thirsty, maybe dry loose stools, waste abdominal pain, yellow greasy tongue coat, slippery, rapid pulse.
Damp heat blocking the lower burner. That's the idea. Affects urinary and digestive tracts. Modifications for pain, standard formulas like modified salmon decoction mentioned to clear damp heat. Urinary tuberculosis, diagnostics, TB history, urinary symptoms, frequency, urgency, pain, blood, lumbar pain, maybe low fever night sweats, weight loss, TB in urine, turbid urine, meat wash water, positive skin test, a TCM pattern, deficiency of kidney yin and lung yin, short cough, scanty bloody sputum, painful bloody urination, lumbago, dry mouth throat, heat in palm soles, night sweats, red tongue, little coat, thin rapid pulse.
Yin deficiency leading to virtual fire.
Yes. Chronic infection depleting essential cooling fluids, urinary calculosis, stones. Symptoms, colicky, waist, lower abdominal pain, bloody urine, passing stones, urinary difficulty, common 20-40 years, more males. TCM, stony stranguria, etc.
Diagnostics focus on pain, blood, stones, urinary symptoms. Modifications mentioned for pain or difficult urination. One pattern, clean deficiency of the spleen and kidneys.
Dull lumbar pain, fatigue, shortness of breath on exertion, poor appetite, loose stools, pale face, pale tongue, thin, feeble pulse.
Weakness contributing to stone formation retention.
Right. Weak lower energizer can't manage fluids waste properly. Uremia, kidney failure. Two patterns mentioned, damp heat pouring downward, edema starting low, scanty yellow urine, pale face, red tongue, yellow greasy coat, thin deep rapid pulse yin deficiency plus damp heat, and obstruction of orifices by turbid yin, profuse phlegm, saliva, nausea, vomiting, edema, lethargy, confusion, cold limbs, pale tongue, white greasy coat, slow deep pulse yang deficiency allowing turbid yin to rise. Differentiates based on heat versus cold phlegm signs.
Hypoferric anemia. Text asks for causes, patterns, treatment principle prescriptions. TCM would look at intake loss, absorption, and differentiate based on organ involvement.
Exactly. Tailoring treatment to the specific TCM diagnosis. Aplastic anemia, bone marrow failure, pancytopenia, Progressive anemia, bleeding, infection, TCM, deficiency consumption, bleeding syndrome, modifications for fever masses, treatment principle mentioned. Soothing liver, regulating qi, resolving blood stasis with modified Gexia-Zuyu decoction. Focus on restoring marrow function via balancing kiblet organs.
Leukopenia granulemia, low WBC neutrophils. Dizziness, fatigue, fever, palpitations, ulcers, infections. TCM, deficiency consumption, dizziness. Treatment likely focuses on tonifying kiblet to support marrow immunity.
Idiopathic thrombocytopenic purpura, ITP low platelets. TCM etiology, external toxic heat, internal heat driving blood out. Or diet overstrain, weakening Qi's hold on blood. Or yin deficiency, exuberant fire-damaging vessels. Dietary therapies mentioned, Wuzhou jelly. Text asks for characteristics and treatment for exuberant fire-deficient yin patterns. Clearing heat, nourishing yin, stopping bleeding.
Anaphylactoid purpura, allergic capillary disorder. Skin petechiachemosis may be abdominal joint pain. TCM, bleeding syndrome, macular eruption. Seen as allergic reaction causing vessel imbalance. Treatment addresses allergies, supports vessels.
Thyroid hyperfunction, hyperthyroidism. Diagnostics, palpitations, heat intolerance, sweating, bulimia meciation, tremors, agitation, diarrhea, menstrual change impotence, thyroid swelling protrusion, tachycardia, increased iodine uptake, T3FT4 antibodies. TCM treatments mentioned? Xiaoyao pill, Jiakangling tablet, Zibodiahong pill, plus simple herbal prescriptions modified for yin deficiency or queen deficiency. Advice: avoid triggers, manage stress, prevent infection, high protein calorie diet, restrict oily iodine food. Text asks to differentiate treat yin deficiency hyperactive yang versus queen deficiency patterns.
Hypothyroidism, decreased metabolism, Haley Salu, listless, sleepy, apathy, edema, cold intolerance, poor appetite, constipation, cretinism, juvenile, adult types, severe, mixed edema, coma, TCM, tardy growth, deficiency consumption, edema, treatments mentioned. Gubi pill, Zhesheng Shenki, Filjinghui Shenki pill, plus herbal decoction for edema, focus on tonifying Qiang.
Benign thyroid tumor. Diagnostics: slow-growing lump, distinct margins, smooth, variable hardness, moves with swallowing, no node enlargement, usually normal function. Scan shows cold nodule. Tests differentiate from cancer. Advice: avoid radiation, manage stress, avoid fatty sweet food, regular checks. Text asks for etiology, diagnostics, treatment by differentiation. TCM might see it as Qi blood stagnation or phlegm nodulation. Treatment aims to regulate Qi, resolve phlegm, soften masses.
Hypofunction of anterior pituitary, hormone deficiency. Pale, listless, cold, low libido, hair loss, amenorrhea, etc. Causes: postpartum hemorrhage, tumor, severe untreated is dangerous. TCM, postpartum consumption, deficiency consumption. Diagnostics: history, clinical signs of secondary gland hypofunction, sex-related adrenal, pressure symptoms, hormone tests, imaging. Pattern mentioned: deficiency of kidney yang with insufficiency of Qi and blood. Pale, cold, tired, hair loss, low libido, etc. Deep kidney yang deficiency impacting Qi blood generation.
Diabetes insipidus, water balance disorder. TCM, etiology, innate yin-yang deficiency or are external factors, emotions, diet, overstrain, sex, trauma. Overall, lung, stomach, kidney impairment, and fluid distribution. Pathophysiology, fire heat consumes lung fluid, kidneys fail to moisten lungs, middle energizer cold impairs transport. Kidney and trauma affect fluid transformation, neuron concentration. Prolonged illness hits yin, then yang. Diagnostics: polyuria, 510L plus, dilute urine, no glucose, thirst, polydipsia, dry skin, constipation, low urine-specific gravity osmolarity, ADH test response, imaging for pituitary issues, focus on organs regulating fluids.
Idiopathic edema. Text asks for pathology and differentiation treatment of Qi stagnation blood stasis versus spleen kidney deficiency types. TCM differentiates based on signs of blockage versus weakness.
Female climacteric syndrome, menopause, systemic changes from declining gonad function, 45 to 55 years, mood swings, hot flashes, sweating, heat in centers, dizziness, tinnitus, forgetfulness, palpitations, insomnia, menstrual changes, joint pain. Prognosis usually good. TCM links to Lilly disease, visceral agitation, etc. Etiology: kidney quiescence decline, Tianguian's Qiblin-yang imbalance affecting heart, liver, kidneys, dysfunctions in liver, gall, bladder, spleen, stomach, kidney, Chongren channels, natural transition causing imbalances.
Myasthenia gravis, muscle fatigability. Diagnostics: fluctuating weakness, worse with activity, better with rest, often starts with ptosis, droopy eyelid, can involve bulbar, facial, neck, limb muscles, ocular bulbar, general types. Text asks for diagnostics and TCM pattern differentiation treatment. TCM likely links to spleen muscles, kidney, essence, liver, sinews, deficiencies, perhaps involving Qi blood. Treatment tonifies deficiencies, improves Qi blood flow to muscles.
Progressive muscular dystrophy, genetic muscle degeneration atrophy, different types. Progressive weakness, often proximal limbs first. Symmetrical atrophy flaccidity. often secondary to nerve issues, injury, malnutrition. TCM, flaccidity syndrome, paralysis spies syndrome, patterns mentioned. Immersion of damp heat, flaccid, heavy, numb limbs, maybe edema fever, chest fullness, yellow, greasy tongue coat, damp heat obstructing channels muscles. And weakness of the spleen and stomach, gradual implacidity, fatigue, shortness of breath on exertion, poor appetite, loose stools, sallow look, pale, greasy tongue, spleen, stomach failing to nourish muscles. Modified Buschen decoction and dietary therapies mentioned. Differentiates based on damp heat versus digestive weakness.
Bell's palsy, sudden unilateral facial paralysis, droopy mouth corner, drooling, can't close, eye raised, brow wrinkle forehead, maybe taste changes, tearing, hyperacusis, rule out central causes. Massage physical therapy mentioned. Text asks about diagnosing treating wind cold attacking collaterals type.
TCM sees it as external wind-cold invasion blocking facial channels. Diagnosis, sudden onset, facial paralysis, maybe aversion to cold. Treatment, expel wind, disperse cold, move blood and face. Acupuncture, herbs, massage.
Ischemic stroke,
Yeah.
lack of blood supply to brain infarction, hemiplegia, conscious disturbance, causes, thrombosis, embolism, can improve if treated early, comorbidities hinder recovery, TCM stroke, channel-involved apoplexy, unilateral paralysis, massage, medicated pillow, Tianma YouTube soup mentioned. Advice, prevent, treat hypertension, atherosclerosis, diabetes, regulated life, avoid wind cold, light diet, no smoking alcohol. Text asks for etiology, pathology, and treatment for yin-yang, rising from liver, kidney, yin deficiency pattern. Focus on underlying imbalances.
Hemorrhagic stroke, brain bleed, headache, vomiting, ICP, hemiplegia, speech consciousness issues, cerebral or subarachnoid, causes agitation, climate change, pressure increase, poor prognosis, TCM wind strike, unilateral paralysis, blood stasis, etiology, internal injury and yang disharmony, blood rebellion, phlegm fire, wind rising, vessel rupture, diagnostics, age 50, hypertension history, sudden onset, headache, vomiting, neurodeficit, CT confirms, patterns, phlegm damp obstruction, blockage, coma, locked jaw, clenched hands, stiff limbs, white face, dark lips, cold limbs, phlegm, dark tongue, white greasy coat, slow, deep, slippery pulse, phlegm blocks channels, and collapse deficiency, sudden coma, pale, open mouth, weak breathing, cold unclenched hands, sweating, incontinence, flaccid paralysis tongue, faint pulse, exhausted healthy key, impaired spirit from extreme deficiency or upward wind fire, phlegm heat. Modifications for specific deficits, PAT meds, Suexiang pill, Huoxi Tongmai capsule, simple prescription for unconsciousness mentioned. Key is differentiating blockage versus collapse.
Epilepsy. Text asks for main etiological factors, viscera, likely emotions, diet, congenital trauma, liver, kidneys often involved, and differentiating wind phlegm obstruction versus internal phlegm fire exuberance patterns based on seizure type, heat signs, tongue pulse.
Schizophrenia, mental emotional behavioral disturbance, incoordination of emotions key, various types. Onset late adolescence, early adult, TCM depressive psychosis, etiology, emotions, liver spleen, excessive thought, heart, constitution, damage phlegm damp, obstructing heart spirit, phlegm stasis blocks blood to brain, diagnostics, bizarre thoughts, delusion, hallucinations, disorganization, social dysfunction, duration, rule out other causes, pattern, stagnation of phlegm and key, depression, apathy, dementia, incoherent speech, mood swings, poor appetite, greasy tongue, slippery pulse, thought, liver, key stagnation, spleen fails, phlegm cloud spirit, modified Swenzorin decoction for insomnia, simple prescription, family diet, exercise therapies mentioned, advice, guidance, consistent treatment, regular life, light diet, focus on heart, liver, spleen imbalance, phlegm key stagnation.
Neurasthenia, fatigue, anxiety, physical complaints, no organic cause. TCM from emotional disorders, yin-yang blood imbalance. Diagnostics, agitation, moodiness, hyperesthesia, fatigue, low efficiency, impaired concentration, insomnia, dreaminess, dizziness, tinnitus, palpitations, emotional instability, maybe menstrual issue submissions, no organic findings. Pattern, liver key stagnation, depression, unease, chest hypochondriac, distension pain, sighing, bloating, digestive upset, menstrual issues, thin, greasy coat, taut pulse, emotions, dietary therapy mentioned, black sesame walnut. Advice, emotional regulation, avoid stressing motivation, balance work wrist, avoid pre-sleep stimulants. Text asks for etiology, pathology, and treatment by differentiation. Strong focus on emotional health.
Senile dementia, progressive cognitive decline, forgetfulness, personality change, impaired thinking behavior, loss of self-care, difficulty walking, Alzheimer's, vascular most common. Prognosis depends on timing control. TCM, cognitive dysfunction, forgetfulness, idiocy, etiology, aging chronic disease, organ-brain marrow deficiency, yin-yang imbalance, abnormal luminescence transformation, obstruction by phlegm blood-brain dysfunction. Deficient essence fails to nourish brain spirit. Location brain linked to heart, kidneys, liver, spleen. Diagnostics, Age, mental, behavioral, physical changes. Focus on age-related deficiency, obstruction affecting brain.
Rheumatic fever, inflammatory disease post-strep. Can affect heart, joints, brain, skin. TCM pattern, when dampness by syndrome. Swollen, numb, painful joints, maybe cold, white, greasy tongue, deep, soggy pulse. Or dull fever, hot, painful joints, thirst, sweating, yellow, greasy tongue, rapid, soggy pulse. Modifications for sore throat, skin lesions, toxic heat mentioned. External paste, dietary therapy, pig's heart with herbs mentioned. Text asks for manifestations, characteristics, joint involvement treatment, Du Hu Jisheng decoction application. Focus on dispelling when damp, clearing heat, nourishing deficiency.
And finally, systemic lupus erythematosus, SLE. Autoimmune, multi-organ, fever, skin erythema, butterfly rash, joint pain, mouth sores. Can involve heart, kidneys, lungs, gut, nerves, mostly young females. Acute, poor prognosis versus chronic, more favorable. TCM links to yin-yang, toxication, butterfly rash, etc., reflecting diverse symptoms. Diagnostics: skin lesions, ulcers, arthritis, kidney signs, proteinuria, hematuria, low blood counts, positive antibodies, biopsy. Patterns: exuberance of heat and toxins, acute severe high fever, rash, purpura, bleeding, restlessness, ascoma, red purple tongue, rapid pulse, deficiency of qi and yin with blood stasis, chronic recurrent low fever, malar rash, dry mouthies, hair loss, photosensitivity, joint pain, dark skin lips, dark purple tongue, thin rapid or knotted intermittent pulse, stagnation of liver qi with blood stasis with liver involvement, hypochondriac pain, chest distress, masses, dark skin bruising, menstrual issues, purplish tongue, taut and smooth pulse, external liquid, dietary therapy mentioned, long-term management often combines Western TCM.
Wow, okay. That was a lot to cover, but it really gives a sense of the breadth and depth of Chinese internal medicine.
It certainly does. And hopefully this deep dive has given you, our listener, that concentrated perspective we aimed for, hitting the key points efficiently.
Absolutely. I know for me, seeing how TCM differentiates patterns for things like headaches or constipation, and the specific logic behind the herbal formulas or even the dietary advice, those were definite aha moments.
And it's crucial to remember this is a truly complex and ancient system. What we've discussed is really just scratching the surface, an accessible starting point.
Right. So maybe a final thought for you listening. Considering how TCM emphasizes everything being connected and how it looks for these underlying patterns of disharmony, how might thinking in those terms offer you a different lens to view your own health, your own well-being?
It's something to ponder. And if specific topics really caught your interest, say the digestive links or the way TCM approaches palpitations, we'd encourage you to explore further. Maybe look into the compendium itself, or perhaps consult with a qualified TCM practitioner.
Definitely food for thought. Thank you for joining us on this deep dive into the world of Chinese internal medicine.